heartwarming story, the Bheki Mlangeni Hospital in Soweto has made history. In keeping with South Africa's pioneering tradition in heart surgery, the hospital performed its first such operation. The patient, Tumisang Motsikwa, was stabbed while trying to assist a pupil after a mugging. Reporter Heidi Giokos spoke to the surgeon who led the procedure at the Bheki Mlangeni Hospital.
These type of operations are usually done ordinarily at a tertiary institution or a regional hospital because of the type of trauma and the urgency of the case. In this particular patient, he was too unstable to be transferred out, so we opted to operate on him on the premises. It's the first that we've done at Bheki Mlangeni Hospital, and we're happy that it had a successful outcome. It's a team effort, so we were happy with our emergency room making a full diagnosis, identifying the problem, and then our theatre staff reacting to that. And we managed to complete the operation, I think, just over an hour, and then he went to our intensive care unit and where they nursed him to completion, and then he was transferred to our ward. So we were happy that this type of trauma was managed at an institution where it needed to be done as an urgent matter, and this particular patient may have lost his life if he had to be transported out.
Speak to us about the trauma that he suffered, because obviously a stab wound is quite severe and quite serious, and oftentimes people don't make it, but he got a second chance at life, especially because of the wonderful team here that was able to perform this under such immense pressure.
Yes, so he suffered a stab heart. The injury entered around his left chest. It went through the pleural space into the right ventricle of the heart. Of course, his blood pressure reacted to that and dropped because of this. An enlarging clot that formed around his heart, compressing the heart and impairing the pumping function or the pumping mechanism of the heart. And it's because of that that these patients then become urgent. So his level of consciousness was dropping. It became really a life-threatening case. So that's why we brought him to theatre as an urgent case.
So we'll obviously be seeing him a little later, but I hear that he's doing exceptionally well. He's actually recovered really well. I didn't expect to hear that he would be here today, but obviously that recovery period is also important and significant.
It's very important in the recovery period. He went to our intensive care unit immediately after the operation. He was discharged 2 days later to the general ward, and he's doing well in terms of being at home. So he's comfortable at home, but he will follow up with us at our surgical outpatients department.